Welcome back to the Lexi's Leukemia channel. Today we're going to physical therapy.
Yes, so we are going to physical therapy, aren't we, Lexi? A little backstory for those who don't follow our updates in the Facebook group is where I update most often, and then also on Instagram. Lexi had blood cancer. She was diagnosed at age about 2.5, and she had treatment until she was almost 5. So about 2.5 years worth of chemo. And one of those chemos is called vincristine, and she got that one all throughout treatment. There for a while, she was getting it weekly, straight into her port. And that is known to cause neuropathy in the legs and feet, which it did for her. She had a lot of toe walking, more so than what you would see from a 2-year-old toddler. So we did physical therapy on treatment, and we also did gabapentin, which is supposed to help with that neuropathy, and it did. And then when she got to the maintenance portion of treatment after a while, it got much better because the vincristine slowed down to every 3 months, and it wasn't bothering her as bad. The steroids that she took causing all the bone pain slowed down to every 3 months. So we were able to wean her off of those medications. Well, unfortunately, when cancer is finished, you're not really done with it. So she finished the chemo and she's considered in technical remission, but she's still dealing with some late effects from all the treatments. So all that neuropathy and the gabapentin caused her to have what's called foot drop. So instead of her picking up her foot and walking heel to toe, she walks kind of shuffling along and leads with her toe instead. It's called toe walking. So it's when you're walking more with your toes than you are on the balls of your feet, and it causes her to get tripped up in her feet and trip and fall. I'll see if I can link some videos up here of some of her other therapy sessions. She even fell and caused herself to break her elbow. I can link that video up here. So there's lots of stuff that's been going on for the past 3 years, and we just haven't been able to get a handle on it. So they have opened up a new physical therapy center, Children's has, in Edwardsville. So for those of us on this side of the river, we don't have to drive all the way to St. Louis. So we are going to head there this morning, aren't we, Lexi? And then after that, we are going to rush back home so that she can get changed, because it is the 100th day of school. So she gets to dress like a 100-day-old person, or excuse me, a 100-year-old person if she wants to, and she does. So we're gonna get her changed for that and then take her back to school. So we'll see you whenever we get to physical therapy. So we made it to the physical therapy. It's this big thing. I'll take a video of it. It's right across from the Kohl's in Edwardsville and the Best Buy, so it's really easy to find. So we'll see when we get inside. The therapist wanted to measure her to see where she was at compared to last time she was measured, and thankfully she didn't lose any of her range. It pretty much stayed the same. She did all the same measurements that the last therapist did, so we were happy to hear that she didn't lose any of her range. We need to continue with her stretches at home, and she also gave us another band to use, one that has more resistance. So Lexi graduated from a yellow to a red band. The rest of the session focused on endurance and strength exercises for her ankles.
Good job. Okay, oh, you want to do a whole lap? Do a whole lap. That looks pretty good. Look at you go. Good job. All right, can you walk backwards? Just a few steps. Nice job. All right, We're gonna go up one more time. If you wanna hold on to the railing, you can, it's up to you. Good job, okay? And then come on down. Good job. This foot all the way down, yep. There you go, nice. All right, oh, you wanna go up one more time? Good job. All right, we're gonna put our shoes on.
Oh, you did it again.
Good job. Nice. That was pretty nice.
I feel like you're still holding back, but.
Good job. There. Good job. What about our left leg? Oh, a nice little ballerina, I see. Good job. That's awesome. You ready? There you go. Yep, so you gotta get underneath it. So I want you to get your toe under and bring your toe up. There. Good job. That's pretty good, huh? Okay. Good. Can you bring your foot down and then up? There. Nice. That one looks good. Down, up. Nice, Lexi. Let's get this foot. I want you to put this foot right here by my finger. So we're right in the middle. Okay. So I want us to do the same thing where we're bringing our toes down and then up, but I want us to try not to move this foot. Okay? Let's try. You got it. Down, up. Down, up. Can you reach all the way over there? There, good. Good job. Okay, let's do, oh, you gotta catch it when it comes back, silly. Okay, ready? And catch, good job. So I want us to keep doing it. Let's see how many we can do. And get our toes towards the trampoline. Yep. Okay, hold on, pause. I'm gonna fix our feet a little bit. Can we bend a little? Bend, bend, bend. There you go. Now go. Whoops. That's okay. I threw you off. Huh. Good job, Lexi. Let's try and bend our knees just a little. There.
She's a little stiff, isn't she?
Yeah. Well, she kind of blocks them out and hyperextends a little bit.
I've noticed that before, like when she gets into doing something, and I wonder if maybe that's some of the leg pain in the front too, because if you stay locked like that all the time, I feel like that might be uncomfortable after a while.
Yeah. So a lot of times if they're losing some range in our ankle, we kind of compensate by that by bending back our knee. So
Okay.
that could be a little bit why.
Okay.
As well as kind of decreased strength to control our knee.
Mm-hmm.
It's easier to lock it out, then our muscles aren't working and our bones are just kind of holding us up.
So then we just compensate, oh, this is easier, it feels better. Gotcha.
Yeah. So that will definitely be something that we'll work on.
Okay.
Good. Can you bring your feet out just a little bit? Now try and get that guy. You're fast. Not bad. Good job. All right. Let's do this. We're going to take these guys whenever you're ready. Yep. So, can we retry the balance beam? Come back, Lexi. Come back, come back, come back. I want us to try and get our heel to touch our toe. So I want your your feet to be close together. There you go. Even closer. Can your heel touch your toe? There. Nice. Okay. So we're going to go up and down. All right. So when we do the scooter back, I want us to sit. I want your toes to be up towards the ceiling. And I want you to try and pull yourself back. Okay.
That's a good one.
Your toes to try and stay up the whole time. Okay? You got it. Yep, so however you want to sit. And then you can hold on here so we don't accidentally get our fingers. Let's turn this way.
Gotta go the other way though.
Look, I'm going to turn you. So we're going to do a lap and start back at the beginning of our obstacle course. So toes stay up. There you go. Keep them up. And then you got to turn. Come all the way around. Good job, Lexi. Up, 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 up. heel touching our toe. A little bit closer. Good. Okay. Go up, down. All right. Here's your scooter. So go ahead and sit here. There you go. You want to turn it. Okay. So toes up, 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 up as high as they can towards the ceiling. Good job. Keep them up, keep them up. Good work. All right, we're gonna do one more round, okay? Okay.
Good job,
Legs
kiddo.
in after doing this, I want you to straighten this leg and lift it up towards my hand. Okay? So it's straight and you're gonna lift. And then down. Good job. Let me see this leg. So we're gonna bend this one. Straight, straight, straight up to my hand. Down. Good job. Was that pretty easy or hard? Glove on. Silly goose. All right, let's get our shoes and our socks back on.
Yay. Well, we're all done with physical therapy. We had a great first session. So we're going to go back the next Friday they have available, which is the 25th, and we're going to do weekly for a bit. We're going to get back into her stretching. They mentioned some things that we hadn't thought about before, like she was locking her knees to compensate for the lack of endurance and weakness in her ankle and making that kind of stiff, and that could be causing some of her leg pain too. So lots of different things to think about and work on, and they definitely could tell that her legs get tired very easily, so we're going to work on that stamina. They want us to go every other week for a few weeks, and then we can drop down to once a month, and then hopefully we won't need therapy long term anymore. So she went ahead and taped her legs for us, and we're going to order the tape from Amazon. We tried the KT tape and it doesn't last very long. After a couple of days it's already trying to come off, so we're going to try their kinesio tape and see. It's called Kinesio Tech or something. I took a picture of it, so we'll see how that goes. All right. So what do you want to tell everybody?
Subscribe and hit the bell to be notified when we upload another video.
Oh, but she said subscribe and hit the bell, but I guess we're not really closing out the vlog because we're going to give you a sneak peek of her looking like a 100-year-old person. So